Hello and welcome, everyone. Thank you for joining us today for our United Medical ACO's monthly diabetes wellness webinar. We are so glad you're here. Each month, we come together in this space to really learn and share and grow in our understanding of diabetes management and in our overall wellness. So whether you are newly diagnosed, you've been living with diabetes for years, or you're caring for someone who has diabetes or going through the process, this series is really designed to give you some tools and resources to support our care with diabetes management and continuing to learn and grow together. So with that being said, I will bring up our presentation and share my screen so we can get started. All right, can you view my screen just fine? Okay, perfect. So before we jump into our topic for today, I'd like to take a moment to acknowledge the wonderful team behind our wellness program. We have Kamal Erkin, who is our CEO. We have Donna Gunkel, who is our Director of Clinical Integration, Dr. Hundel, who is our endocrinologist and program manager, myself, Caroline Weber, and I'm the lead dietitian and program coordinator. And then we have our lovely social workers, Roxana Portlock and Carla Williams. So with our diabetes wellness program, we really focus on the ways diabetes affects our lives, physically, emotionally, and especially practically. We cover everything from managing your blood sugar levels to understanding how diabetes impacts the different areas of the body. Most importantly, we provide practical strategies that we can really use to improve our health, our quality of life, and our blood sugar numbers too. And each month, we hope to focus on featuring expert voices across a variety of specialists. We've had endocrinology, cardiology, nephrology, podiatry, social work, and so much more. And today, we have Dr. Hosmane, our optometrist from Hosmane Eye Care. She won Delaware Today Top Doctor 2025 in the category of optometrist. And we're so excited to have her on today to really discuss her expertise around eye care, vision, protecting our vision with diabetes. And then I will be wrapping up our session with some dietary recommendations that can help support and protect our eye health. So with that, let's get started on today's topic of taking control of eye health with diabetes. I'll hand it off to you, Dr. Hosmane.
All right. Thank you, Caroline, for that very lovely introduction. I appreciate it. Good afternoon, everybody. I'm glad to be here to talk a little bit about diabetes and the eye. I think it is a super, super important thing to talk about, especially because diabetes is something that a lot of us have these days. The CDC estimates that about 1.6 million Americans have it. And it is actually it is the leading cause of blindness in not only this country, but actually worldwide as well. So we probably know diabetes, there's really two main forms. There's what's called type 1. And in this form, what happens is the pancreas, which is the organ that produces insulin. Now, this pancreas sits behind the stomach and in front of the spine. So what happens is when the insulin is produced, there's actually a reaction by the body where it attacks the cells that produce the insulin. So it's actually an autoimmune condition. So what happens is, unfortunately, technically the body is producing it, but it's not able to produce it effectively where the cells are able to do their job. So in that case, we don't have the insulin available. Type 2 is a little different. We have the insulin available, but there's what's called resistance, where the insulin is not able to do what it needs to do. The body kind of puts up a little fight, and the insulin is not able to do its job. So this is the more common type. Type 1 we typically find usually people that are age 40 and below. Type 2, typically the diagnosis is in someone a little bit older. In fact, some folks don't even really know that they have it, and then we figure it out a little bit later on. So, that's where the diet modification comes in, exercise, medication, and then, of course, maybe some insulin there as well. Next slide, please. Okay, so this is really important for us to know as providers, and also it's one of those things where I always ask my patients if they know what their A1C is. So really, it's actually called hemoglobin A1C. So what is A1C? So if we can imagine, we have different types of cells that are circulating in our blood, and one of them is a red blood cell, which lives about 3 months or so. So, as part of the red blood cell, we have what's called hemoglobin, and then it's carrying oxygen throughout the body for us. So, when we have this blood sugar circulating, what happens is there's this stickiness to this hemoglobin where the blood sugar attaches itself. So, the more you have in your blood, the more stickiness happens. So, what that means is when we measure this percentage, the higher it is, then definitely tells us there's more sugar circulating. So this is a number I always like to ask my patients about if they know. And if we look on the little table to the right, it gives us, really what's in range. So if you look at that in range value, anything from say about 4.8 to 5.6 is considered in range or normal. Anything above that, 5.7 to 6.4, is in the pre-diabetic category. And then anything above that is considered diabetes. So, sometimes we have our fasting blood sugars that are really not too bad. But if our A1C is high, we know that there's just a lot of up and down happening for numbers, and we need to improve our control. So certainly the higher the A1C, the better we need to try to be as far as our blood sugar. So A1C typically, done at least twice a year, if not more. And the goal is to have it less than 7%, depending on the patient. Next slide. So, before we talk about how diabetes affects our eyes, let's do a little review in terms of what we have in terms of eye structures. So, if we go from front to back, we have the cornea there, kind of the third one up from the bottom. And that's what I like to call the window of the eye. So this is where the light enters, goes through our pupil, goes to that lens there in the middle, and then finally gets to the back of the eye after it passes through the gel, and then gets to the retina. So the retina, we call it like the back wall of the eye, full of blood vessels and tissue. So we're going to talk a little bit about how these eye structures are affected by diabetes. Next slide. So we hear of what's called diabetic retinopathy. So we just talked about the retina. So anything that affects the retina is called retinopathy. So you can have retinopathy from diabetes, you can have retinopathy from high blood pressure, and other conditions as well. So what is diabetic retinopathy? So basically, it is when we have blood vessels that are damaged. Now, these blood vessels are actually very, very tiny. They're capillaries. So, what happens is if they're damaged, we don't actually almost really see it very easily in the beginning, but we think of it like wear and tear that's happening. So, what's happening to them? So, if they start to have wear and tear, then they will start to leak. There's some swelling that happens. Sometimes actually, because they're damaged, the eye will start to grow new blood vessels, which are not normal. Those will start to break. And the more we have going on, then the more of course it's going to affect how we see. And the more we have, the more likely it is it's going to cause our vision to be affected. And again, this is one of the reasons why we can certainly lose our vision as well. So what kind of things would you see? Now, it's interesting. Sometimes you don't see anything different at all, but typically, if you are not under good control, or sometimes if you really don't even know that you're diabetic, you'll probably notice some things like blurry vision. Sometimes your vision will fluctuate. Sometimes it'll be clear, sometimes it'll be blurry. You will have, these missing spots in your vision, vision that kind of comes and goes. You might see what are called little floaters in your vision. You might see flashes of light. So, certainly we want to watch out for these symptoms if you ever notice anything like that you may not have had before. So, as we're saying earlier, type 1 is usually diagnosed in folks that are a little bit younger. But the retinopathy doesn't always show up right away. It usually takes a little bit of time for it to show up. Now, type 2, though, is a little different. Sometimes it's already there by the time you've actually figured out that, okay, I am actually diabetic. So, the more we time that goes by, the more likely it is that we have something going on. So even in my patients where they're under good control, they're doing everything that they need to do, once they've reached that 15-year mark, that 20-year mark, I usually find something in the eye. And that again, if we think of it like wear and tear happening, it's going to end up, showing us something going on in the back of the eye. So what other things can happen? So we have the area of the macula. So the macula is a very center part of our vision, like what we call the 20/20 area. And you can actually have swelling in that area. So that's called diabetic macular edema. If this happens, then the blood vessels in that area will cause a swelling, and then you will have the center part of your vision be affected. And this is something that you will definitely realize you're not able to see the same way that you would normally. So there is a risk just that as you're diabetic, that you will, at some point be more likely to end up with macular edema. Now it can be treated. Now, you can use steroids, laser. These days, it's really more of injections that are used. But, again, that center part of the vision being affected then will make us think that, there's maybe some macular edema happening. Those little abnormal blood vessels that we were talking about before, what happens is that they're not normal. They really shouldn't be there. And sometimes they end up being pulled on. And if they end up being pulled on by the gel that's in front of them, they actually will break. And then you will have a detachment, or you might have a situation where you're actually bleeding in the back of the eye. So this is a picture that shows you what the retina may look like. Now, this is a patient definitely who has not either been under very good control, most likely, or, may have had other things like high blood pressure along with diabetes. But if you look at the retina on the left, this is a pretty normal retina. You see the blood vessels, you see that little optic nerve in the middle there, and you see that little cherry spot in the middle, which is the macula. The retina on the right, as we see, is pretty messy. We see a lot of bleeding. We see in the central area where the macula is, we have all these little yellow deposits there. So this is a stage of retinopathy where there's a lot going on. So when we have someone that looks like this, we know that the control is definitely not where we need it to be, or that person may not even know that they have diabetes. This is another complication that can happen. A cataract, I think we've all heard about a cataract. It's when that lens inside the eye becomes a little bit cloudy. Now, granted, we all develop cataracts eventually. It's caused by normal aging of the eye. It's caused by damage from the sun. But, when you're diabetic, because of that higher level of blood sugar, two things can happen. First of all, the sugar ends up going into the lens, and the lens swells up, and then your vision will be affected. And then also the lens will be more likely to become cloudy. So that's really what a cataract is. So as we can see, when you're diabetic, you're actually going to be more likely to develop cataracts. So about 2 to 5 times more likely. So you're going to develop them earlier, and they're actually going to grow more quickly as well. Now, if you're not wearing sunglasses, that's going to make them grow more quickly. If you're going to smoke, that's going to cause further damage as well. And then also if you're taking medications like steroid medications by mouth, especially, that's going to cause the cataract to grow more quickly as well. So we want to definitely make sure we put some sunglasses on. This is another complication that can happen. We hear of something called glaucoma. What is glaucoma? So glaucoma affects the optic nerve. Now, we think of the optic nerve, if you can imagine kind of this eyeball, we think of it like that little tail that comes out of the back of the eye and then goes to the brain. So the optic nerve is basically our relay cord that takes all the visual information for processing. It takes it to the brain. So when we are diabetic, it unfortunately puts us at a little bit more risk of certain types of glaucoma. Now, glaucoma is interesting because you can have glaucoma and not see anything or feel anything different. So, this is why, when you have an eye exam, you will always be screened for glaucoma. And, you might need eye drops or surgery, depending on what type of glaucoma you have. But it is a risk factor, so we have to be mindful for that as well. Glaucoma is a little different because it doesn't affect your center vision. It actually affects your peripheral or your side vision. So, you want to do things like a visual field, for example. And of course, when you have your eye exam, we look at the optic nerve and we check your eye pressure, of course, as well. So this picture is nice because it shows you, what we just talked about. We have the cataracts there, so you can see the lens is a little bit cloudy. We can have glaucoma there on the bottom where, you have this increase in eye pressure, which ends up then damaging the optic nerve. And then the top left picture there is kind of a schematic of the retina we actually looked at before, where we have these little changes as far as bleeding, what are called cotton wool spots, abnormal blood vessels, and that shows you what diabetic retinopathy looks like. So, is there a treatment for retinopathy? Yes, there is. It really depends on what it is, where it is. The most important thing, of course, always has to be we need to make sure our blood sugar is under control. That is the most important thing. So I should have probably put A1C in front of treatment, but that's really the most important thing. Now, if you have these new little blood vessels, your ophthalmologist will probably do a laser to, stop them from leaking. If you have diabetic macular edema, sometimes you do need an injection, which again regulates the blood vessels and stops them from leaking as well, and reduces the swelling so that over time your vision will improve. Sometimes if you have retinopathy that's very, very mild, you may not even really need treatment. I have a lot of patients where if they come in and they do have some retinopathy, if it's mild especially, I may end up seeing them just, every 6 months instead of once a year. Observation is really, really important. I don't let them go more than a year. The more there is going on, the more often I'm going to end up seeing them. So, sometimes we can just observe, but sometimes there is some treatment that we also need to do, along with still making sure we keep our blood sugar under good control. So I wanted to also talk a little bit about what are called GLP-1 receptor agonists. And we hear a lot about these days. I know Caroline might talk about them a little bit as well. But GLP is glucagon-like peptide, and it's something that's created in the body naturally. And what it does is it helps the pancreas to release the insulin when the blood sugar is high. The pancreas does two things. It helps to regulate digestion by creating enzymes. It also produces hormones for blood sugar regulation. So the GLP-1 helps the pancreas to do what it needs to do. So it also slows down how quickly your stomach empties, and then it really suppresses your appetite. It doesn't really make you feel like you want to eat anything. So these medications, which are listed here, these are just some examples, and you might recognize some of them. You may be taking some of them. They're actually not new. They've become a little bit more popular these days because they've actually been used for weight loss now. They've been around for some time. Like Ozempic, for example, has been actually around since about 2017, I believe. It's just that they're being used a little bit differently these days. Some are injections, some are oral medications, but basically what they do is they work like the GLP hormone, and they mimic the action. So you get the same results of being more full, and then therefore it helps to regulate the blood sugar as well, and it helps you lose weight. The reason I wanted to talk about these is while they are successful, there is some controversy as far as some negative things to these. There have been a few reports where these medications actually have caused the diabetic retinopathy to become a little worse and vision to become a little worse, and we think that's a little bit interesting. Why is that? And the reason that is because the blood sugar will tend to kind of steadily drop, and perhaps drop quickly and rapidly. And the blood vessels have already had wear and tear to them. So while this is trending us in the right direction, as we can say, it's actually causing a little bit of extra strain initially to these already damaged blood vessels. So, in some patients, especially those that already have some amount of retinopathy, some patients actually have had the retinopathy worsening. Now, again, there's some controversy. that may not be true necessarily. And if it has happened, it's happened in very, very few people. There have been some people that have actually lost, a large amount of vision, but, this is certainly not a reason to stop this medication. The benefits and the risks have to be considered. And if the benefits outweigh the risks, it makes sense to take this medication. But it's important, if you are taking this medication, that you really should be getting a comprehensive eye exam, ideally prior to starting this, or if you haven't had a chance to do that, really getting an eye exam shortly after starting this medication so that we can take a look at your retina and just make sure that it looks okay, that nothing has been changing quickly. And of course, you're going to be, getting your eye exam regularly after that. So we really want to make sure that, as a diabetic, there are a number of things we do. So even though I'm there to check people's eyes, I always talk about the eyes, I talk about the kidneys, and I talk about the feet. So that's really, really important. So what's really involved in diabetic eye exam? We check everything from front to back, so along with checking your glasses and your eye pressure and everything like that. The most important thing is what's called a dilation. So a dilation, I think most of us are familiar with. We put some eye drops in, makes the pupil bigger. I always describe it like I'm trying to look into a keyhole to see the room. If my keyhole's kind of small, I don't really see much of the room. If I make my keyhole bigger, I see more of the room inside. So the good news for me for that is I get to see more. The not so good news for my patients is, you're going to be a little bit more light sensitive, but it's only going to be for an hour or two. So that's the trade-off. As long as you have your sunglasses, you're just fine. You can drive as well, actually, if you like. But this is really, really important. So, if you're going to come in for an eye exam, if you're diabetic, be prepared that you're going to have your eyes dilated. How soon should you have an eye exam? So certainly in the earlier part of your diagnosis, maybe not exactly within 5 years, maybe 5 years and after, you want to make sure you have your eye exam done. Now, depending on whether, again, you're type 1 or type 2, type 1, you may not need to be seen right away. Type 2, definitely sooner rather than later. You can have changes. And again, as we're saying before, not really have any symptoms. So you definitely want to be checked. If you have an eye exam and there's something there, again, we can try to nip it in the bud, so to speak, so that we don't cause further vision loss or further changes. We do have screening photos and screening tests these days. They're really not going to be equivalent to really having a dilated eye exam. We can see around the eye as well, check the outer part of the eye. The photos are flat pictures. So you always want to make sure you have a dilation and not anything that really substitute for a dilation. What else can you do? So you also want to make sure, again, like I say, I would tell my patients, it all comes back down to control. So if you have blood sugar, trying to make sure you keep it in control. Keep your blood pressure under control. Same thing with your cholesterol. If you are outside, make sure you wear your sunglasses. That's really important to reduce the likelihood of cataracts happening. If you're smoking, make sure you're considering quitting. Sooner rather than later is helpful. Smoking is a risk factor for not only the cataracts, but macular degeneration as well. So it's really, really important to make sure we try to work on that as well. Diet's super important as well. I know Carol's definitely going to talk about this with her section, but green leafy vegetables, fruits and vegetables, everything that's good for us anyway. Try to have a vitamin that has lutein. Everything that you're going to do to keep your body healthy. I always like to say healthy body equals healthy eyes. So if you eat well, your eyes are going to show that as well. And then lastly, I think I just have a couple slides left. This is a little infographic where I think it kind of very nicely summarizes a lot of the things that we've talked about. We see in the middle section there, again, that it really just says we have a large number of folks these days that are diabetic. It does say we're going to reach about 11 million people by the year 2030. So that's a large number there. We talked about what we can do to detect it. And then at the bottom, there's a little thing that says track there. So it says take your medications. That's for T. R is reach and maintain a healthy weight. A is add physical activity. I think that's really, really important. So I have patients where, I'll tell them, do you exercise? Do you get out? Do you get up and move? Getting up and moving is really important. Even if you're doing everything else you're supposed to do, you have to keep active as well. That goes hand in hand with doing everything else. The C is for controlling your blood pressure, blood sugar, and cholesterol. And as we said, kicking the smoking habit. And up top again, we see some complications there as well. Nice little pictures to demonstrate what what will look like if you had those conditions. And then lastly, again, A, B, C, D, E, just a little summary here. A is your A1C. And I always tell my patients, see if you can remember what your A1C is, keep a note of it, keep a log so that, when you come in to see me or see somebody else, if we're not all connected in terms of our medical records, that way it'll help us to manage your blood sugar. Blood pressure control, good for your kidneys as well, of course, and your heart and your eye health. Manage your cholesterol, don't smoke, and then of course get that eye exam once a year.
Awesome. Thank you so much, Dr. Hosmane. That was very informative, just on overall anatomy of the eye, but also risk factors and associated with treatments. Very, very informative that I think all patients could use. So diet now is where we go. Great intro of prevention, working on prevention of diabetic eye complications, especially diabetes related retinopathies. So we're going to dive into some specific dietary recommendations that can really support the health of the eye. We're going to talk about what we can eat and how it directly impacts our eye health, especially when managing our blood sugar levels. Specifically, a lot of research has been given to anti-inflammatory and antioxidant-rich foods, which reduce the risk of diabetic retinopathy, which is a common complication, as Dr. Hosmane had stated. So these foods really help fight the inflammation and oxidative stress in the body. And two things, the two things that play a major role in the development and progression of diabetic eye disease. So we want to help calm that inflammation throughout the body, provide antioxidants, which kind of act like little bodyguards. They protect the cells, especially sensitive ones in the eyes, from that oxidative damage, and then promote healthy circulation, which is critical for kind of keeping those tiny little vessels in the eyes nice and strong. So some great foods to include are going to include some fatty fish like salmon. You might find mackerel, sardines, really rich in those omega-3 fatty acids, which are super protective and help reduce the inflammation, support the blood vessel health in the eye. We've also got fruits and veggies, like the leafy greens, like we just talked about, colorful ones like berries and carrots and bell peppers. They're packed a lot with vitamins and minerals, which we'll get into in a moment, and a lot of really good antioxidants, like our vitamin C, our beta carotene, our lutein, all which are really super beneficial for our eye health. There's even herbs and spices, oregano, rosemary, cinnamon, turmeric. They add flavor without, adding salt and adding sugar to your meals, but they have a great natural anti-inflammatory property and antioxidant properties to them. There's also those nuts and seeds like walnuts, chia seed, flaxseed. I always like to call these the nutrient boosters because you can add them to anything. If you're looking for a minimal way to add extra really healthy fats and fiber to your diet, adding like sprinkling chia seed or flax meal into your meals is a great way to take a step forward into increasing these really good nutrients in your diet. Incorporating them regularly can go a really long way in just prevention and supporting overall wellness. They also cross over into other prevention of other chronic diseases too. Like, if we're pre-diabetic, these foods help us to avoid high blood sugars over time, help our heart health. They all overlap with other health conditions and prevention. So you can't go wrong by including anti-inflammatory and antioxidant-rich foods. We've got kind of specific dietary patterns that can contribute to elevated glucose. We know that certain foods support our eye health, but vice versa, dietary patterns can work against us, especially when it comes to managing our blood glucose. Like Dr. Hosmane said, managing the A1C and the blood sugar is number one. We want to make sure we decrease that risk the best we can. And we know that with increased blood sugar leads to increased inflammation and increased damage to the eye. So certain types of patterns that we have with our eating behavior can really spike those sugars more easily, more quickly. So it's really important to monitor and limit the intake of some of these foods, like our sugary beverages, sodas, sweet teas, energy drinks, even some fruit juices. Like, I know it's fruit, but sometimes that fruit juice has extra added sugar in it, or it's just a lot of sugar for your body at one time to process. And so that leads to elevated blood sugar spikes, which sometimes can be hard to control, especially if we're intaking a large amount of these sugary beverages. Alcohol, which can both raise and drop the blood sugar unpredictably. So we're also seeing that it adds, excess calories or excess sugar that doesn't offer any nutritional benefit for you. So you're not getting the best bang for your buck with the beverage that you're intaking. So it can increase the inflammation, of course, but lowering our intake of alcohol, keeping a moderate amount in our diet. If you're going to consume it, be sure to talk to your doctor about, right amount for disease prevention. If you're, more at high risk, we might want to eliminate alcohol completely, or we might want to talk about what is a generally safe amount you can consume without increasing your risk too much. Ultra processed foods. I always like to talk about the difference between processed foods and ultra processed foods. Most foods go through processing, like your protein powders or your protein bars or your frozen veggies. They're considered a processed food. But ultra processed foods, chips, cookies, candies, baked goods, cereals, ice creams. A lot of these foods are high in calorie, but low in those nutrients, those essential nutrients like vitamins and minerals and fiber. They tend to have more added sugar, those unhealthy fats, and then sodium. So we want to try to limit these because these have a negative effect on our blood sugar when consumed in high amounts. You might also see the same effect with highly refined carbs, like our bagels, our white bread, our white pasta, and crackers. They just tend to raise the blood sugar pretty fast and can lead to elevated numbers over time. So should we avoid all of the foods that increase the risk? I get that question a lot. Just tell me what to cut out. And it's not really that simple. It's not about never eating these foods because we want to create sustainable goals, right? We're not unrealistic in saying never touch, a bagel again. It's more about being mindful about how often and how much we consume. And this is where that individualized approach comes in, where we talk, in nutrition counseling about what does moderation look like for you? How do we, incorporate some of your favorite foods while monitoring your health conditions and meeting your health needs? So keeping those quote unquote bad foods to a minimum can really help protect your eyes in the long run. But it's not as simple as a yes or no, or off limits, or completely bad food. You don't have to be perfect to protect your health. It's more about enjoying some of these foods as like a treat or a comfort from time to time. But what matters most is what we do consistently, not just on occasion when we're enjoying the company of friends or it's a special occasion. When we focus on that whole food, nutrient rich food approach, most of the time, and being mindful of those portions and frequency when it comes to those more processed sugary items, we can still enjoy those foods, but also support our blood sugar and our eye health and overall wellness. I really do love this little infographic here where it's good food, bad food. We change the language. More nutrient dense food, less nutrient dense food. We, of course, want more of that nutrient density. And then we want to keep those less nutrient dense foods as just for something fun, for occasion, but having a little bit more mindfulness about when we consume those foods. So some specific vitamins and minerals to keep in mind, especially because when we talk about nutrient density in a food, we think about all those little micronutrients in there that are giving us some beneficial things that we don't even think of. There's no one size fits all approach, right? Especially when we're managing our diabetes, our recommendations are very individualized based on your medical history, your blood sugar control, your preferences or cultural history, lifestyle. So what works well for you might not be the best fit for another. But we do know that a certain amount of nutrients are really helpful when it comes to protecting your eye and possibly slowing the progression or prevention of diabetic retinopathy. So some key nutrients that have positively been associated with our lower risk are, of course, our omega-3 fatty acids found in fish, walnut, flaxseed, chia seed, and they help reduce the inflammation and support that healthy blood vessel. Also, there are some great eating patterns like the Mediterranean eating pattern that kind of covers a really rich omega-3 fatty acid. So that's a great resource to go to if you're looking for ways to include these foods more regularly. Fiber, I will speak fiber till the cows come home. Fiber is the best nutrient out there for disease prevention, in my personal opinion and professional opinion. But from whole grains and fruit, vegetables, legumes, fiber is like that number one disease preventing nutrient that covers everything. It helps with weight management, blood sugar control, kidney health, digestive health, especially eye health, because it's going to help manage your blood sugar levels and support overall vascular health. So fiber is going to be essential, and we can find that in our whole grains, fruits, vegetables, legumes, nuts, seeds. We also have some of those eye-promoting vitamins like lutein and zeaxanthin, which are powerful antioxidants found in those leafy greens like spinach, kale. You also find it in egg yolks, helping to prevent the eye, protects you from eye damage. And you also have the vitamin C, which is a potent antioxidant, of course, in our citrus foods, your colorful vegetables like your bell peppers, strawberries. It helps to reduce that oxidative stress. We also see vitamin E, which is our nuts, seeds, vegetable oils, also helps protect from cell damage. And then zinc, which plays a role in our immune function, also great for maintaining healthy vision. You'll find zinc in foods like legumes, pumpkin seeds, seafood. So we see that incorporating, a variety of foods is going to help us reach these nutrient levels. With a well-balanced diet, whole food approach, for the most part, can really support and reduce that risk over time, especially when paired with that consistent blood sugar management. So we want to make sure that we keep these high vitamins in the back of our head, and think of food as nutrient dense, right? If we go for that whole food approach where you've got a lot of variety in your diet, rich in all the food groups, then you're most likely getting a really nice amount of all of these different vitamins that are super protective. So just a note on mindfulness with supplement use. They definitely have a time and place, and it's in some cases super helpful to fill nutritional gaps, especially if you have very specific preferences or tolerance issues with certain nutrients. But they are definitely not a substitute for a healthy and balanced diet. So it's important to follow your physician and your dietitian's recommendations when it comes to supplement use, because what works for one person definitely might not be appropriate for another, especially when you're managing diabetes or any other chronic health conditions. Um, if you decide to start a new supplement, very important that you let your doctor or your dietitian know, just because they can interact with some medications, affect your blood sugar levels in really unexpected ways. So just for safety, making sure your care team is aware. Um, just a note that supplements are not regulated in the same way that medications are by the FDA. So this means that quality, purity, and dosage can really vary among different brands. So going with a trusted brand, talking with your physician about what are the best brands for you, dosage amounts. Good news is we can get a lot of these key nutrients, like omega-3s and fiber and things like that, from our diet. But there is a time and a space for supplement usage, especially when you're talking to your doctor about your plan of care. So supplements are great, just making sure we keep a close eye on when we are adding new ones in and keeping our physicians and our care team in the loop. And then to wrap up today, just talking about how anti-inflammatory and antioxidant rich foods, of course, can be food first approach, right? We can include these foods to be really supportive of our eye health, help prevent or slow the progression of diabetic eye complications. And on the flip side, that blood sugar control is super important. So certain dietary habits like high refined carbohydrates and higher sugar foods can definitely impact our blood sugar over time, leading to the progression of risk or disease. So we want to take into mind that all foods fit, and it's a pattern that matters over time. So a well-rounded eating pattern with our fruits, our vegetables, whole grains, lean proteins, and healthy fats can really help us meet those needs of blood sugar control and protecting our eyes as well. So managing diabetes is, of course, a journey, and you don't have to do it alone because we are here to help guide you. So with the right info and support, like everything we talked about today, we can really improve health, overall well-being, blood sugar control. So Dr. Hosmane, thank you so much again for joining us and sharing your experience. And next month, we are talking about the 2025 guidelines for diabetes care. So feel free to join us on our next webinar, everyone, and we will see you next month.
Have a good day, everyone.
Thank you. Bye.
Bye-bye.